speech-language pathology graduate student at the Mississippi University for WebEd. Today I will be discussing a research article titled, Who Receives Speech-Language Services by 5 years of age in the United States? This study was conducted by Paul Morgan and colleagues. It was published by the American Journal of Speech and Language Pathology in November of 2015. About half of the children that receive intervention services through Individuals with Disabilities Education Act and Early Childhood Education programs are due to speech-language impairments. Children with speech and/or language impairments often exhibit difficulties with reading, math, and behavior. These difficulties could be a risk factor for educational issues later in life. Delays in expressive vocabulary typically foretell struggles in comprehending oral and written information, communicating with adults and peers, and controlling emotions. Children that are minorities and/or are from low socioeconomic backgrounds may present with more severe speech and language difficulties. Identifying certain risk factors may help to improve screening and diagnostic processes so that more children that need services can be identified and receive the appropriate intervention to improve speech and language development and also to prevent academic difficulties later in life. The general purpose of this study was to determine which children in the United States are most likely to receive speech and language services by 5 years of age. The article analyzed and identified some factors that may contribute to obtaining speech and language services in early childhood. With the conduction of this study, answers to 2 questions were sought. The first question investigates to what extent do delays in early vocabulary increase the child's probability of receiving speech and language services. The second question expands the first question by asking if minorities are less likely to obtain services in comparison to white children. The researchers hypothesized that children with early expressive language delays would be significantly more likely to receive speech and/or language therapy and would continue as the child got older. The hypothesis for the second question was that systematically, Black and Hispanic children would be less likely to receive services due to low socioeconomic backgrounds, cultural and linguistic characteristics. Other factors were also taken into consideration, such as very low birth weight, maternal depression, and family socioeconomic status. These factors help to determine if there is an association between certain characteristics and needing speech and language services. The design of this research study is correlational. A correlational study determines whether 2 or more variables are correlated. This does not mean cause and effect. The study analyzed the correlation between early vocabulary delays at 24 months and the likelihood of receiving speech and language services. It also analyzed the relationship between minorities and their likelihood of receiving these same services. The study reviewed longitudinal data from early childhood longitudinal study birth cohort and analyzed the factors that could be predictive of receiving speech and/or language intervention. The method used for conducting this study was multivariate logistic regression analysis consisting of about 9,600 children and families. The families selected all participated in the early childhood longitudinal study birth cohort. The data included information about birth, cognitive, behavioral, and physical functioning of the child. Interviews with parents were also conducted to obtain information. This data was analyzed at 24, 48, and 60 months of age. At 24 months of age, expressive vocabulary was evaluated. Then, at 48 months, receptive vocabulary was obtained. At 60 months, reading levels were assessed. Analysis was performed by using cross-sectional and longitudinal multivariate logistic regression models at one point in time and at the 24 to 48 months and the 24 to 60 months of age. The results of the study indicate that expressive vocabulary delays at 24 months are strongly correlated with and predictive of a child receiving speech and language services at 24, 48, and 60 months. At 24 months, 2.2% received services. At 48 months, 3.9%, and at 60 months of age, 4.4% of children received speech and language intervention. Another sample of information concluded that children who spoke the fewest words were significantly more likely to receive services. Of a sample of children that spoke 0 to 5 words at 24 months, these children had the highest percentages of obtaining speech therapy. At 24, 48, and 60 months, 28.4, 44.4, and 31.2% sought out speech and language therapy. Results also showed that Black children, minorities, lower socioeconomic backgrounds, and parents that did not speak English as their primary language were less likely to obtain therapy. The likelihood that Black children would receive speech therapy was about 45 to 60% less than white children. This was consistent at all the age categories. Hispanic children were less likely to receive services due to English not being the primary language spoken in the home. Children born with very low birth weight greatly increased the need for services at all the age categories as well. The conclusions from the results of the study confirmed the belief that children who have expressive vocabulary delays at 24 months of age are at a greater risk of needing speech and language intervention later in life. Resulting from this study, a greater understanding of the types of factors that can be related to receiving speech and language services have been identified. These factors include, but are not limited to, very low to moderately low birth weight, ethnic minority, a non-English speaking home, maternal depression, externalizing behavior problems, a low receptive vocabulary, and low reading levels. By having a better understanding of these risk factors, we as SLPs can be better screen and diagnose children, hopefully even when intervening at an earlier age or at least before entering kindergarten. We also have a better understanding of how often and to what extent speech therapy services are being utilized. There is a need for more education and advocacy to increase access to services for children from culturally and ethnically diverse backgrounds. The findings from this study could be used as evidence to push the need for screeners to be more culturally and linguistically sensitive and also include dialectal differences. The study also provided information about the limitations that were accounted for in the study. When interviewing and obtaining data from parents, the researchers depended on the accuracy of whether or not the child actually received speech and language services. Also, the type and quality of services were not taken into consideration when conducting this study. Another limitation that occurred was the differences in eligibility for a child to receive special education services. The criteria for eligibility is different among the different states. My overall impression of the research was that the study was well conducted and accounted for multiple variables that could be contributed to impairments in speech and language development. In my opinion, the research design was strong because a variety of factors were taken into consideration when using the regression analysis model. The article included detailed information about the value that this study provides for society. So, for example, results and the conclusions from the study could possibly be used to help teachers or speech-language pathologists and even policymakers to better provide appropriate services for children that might need speech and language intervention. The article thoroughly explained the procedures that were followed and the methodology used to conduct the research study. The article included easy-to-interpret charts and explaining different factors that may contribute to the receipt of services at 24, 48, and 60 months of age. The study also plainly stated its limitations. It also reported the external factors that were not controlled for, like the possibility that some parents might not accurately report data. The study could have added more information about this study and expanded or revised what they would do to investigate further. The article did disclose information about funding and that no